Hello, everybody. This is Dr. Hamid Elmiar. I am the host of podcast with Dr. E. At this podcast, I sit with the world's experts in health, education, and community development to talk about current health challenges and ask them to share their experience, knowledge, and thoughts with all nations across the world, especially the developing countries, so that we can learn from experts across the globe. Today, I have an amazing guest on the show. Dr. Joseph Pedoto is with us today. He is a well-known psychologist and a very seasoned health professional. And I really appreciate your time, Dr. Pedoto, to be with us today.
No problem to me. Looking forward to it.
Dr. Joseph Pedoto has a very extensive background and in psychology, including working in college counseling, administration, inpatient psychiatric settings, and he also served as a professor for a long time. And Dr. Pedoto is a licensed psychologist in New Jersey and New York. He also did his postdoctoral fellowship at Albert Ellis Institute in Manhattan, and he is a certified supervisor, rational emotive behavior therapy, and we will soon let's hear more from him as we start this conversation. Today is going to be a very interesting conversation. As you all know, in the previous shows, we started talking about this pandemic, the coronavirus, and I had so far physicians on the show and public health professionals who talked about the public health implications of the coronavirus, as well as the physicians talked about their experiences in clinical settings. And today we're going to talk about the psychological perspective and implications of this pandemic, as well as the insight and knowledge of Dr. Pedoto today.
Thank you for having me on your show.
It's a pleasure to have you on the show. And like usual, let me start this very first question, which is a little more of a personal question. And it starts with why you do what you do. And perhaps you can tell us more about your experience.
Well, for me, it really started in high school. I went to a Christian Brothers High School in Jersey City, New Jersey, and was exposed there to psychology. And my first psychology class was actually in high school. And I just fell in love with psychology. And as a matter of fact, the Christian brother who was teaching the class told me that he thought I would make a good psychologist. For whatever he saw in me at that time, I'm not sure. He didn't elaborate on that. But he was right. I was hooked the first time I became a student of psychology in high school. That was the foundation for my further study. I went on to major in psychology as an undergraduate. And then actually I went into a master's program for educational psychology. At that time, I thought I wanted to be a school psychologist. I backed off that idea and went to work after I completed that degree. I started working with people who had drug and alcohol issues, and then went on to work at a community college, working with disadvantaged students in a tutoring and counseling program, of which I was the director. After a period of time, I decided to continue my education, went back to Seton Hall University, obtained a doctorate in counseling psychology, and my career went on from there.
Well, great. Thank you so much for sharing that with us. This question that a lot of my audience were asking in the previous shows that we had, and we had the feedback from people, and I was looking for psychologists to talk about these issues. You know, the psychological implications of this pandemic is huge. What are some of the psychological implications of the coronavirus, in your opinion?
Well, here is what I'm experiencing in my private practice. So this psychological pandemic and uncertainty begets a variety of questions that people have.
Right.
Will I get sick? Am I going to get sick? Will a family member get sick? Will I lose my job? Will there be a vaccine? Will there be, should I get vaccinated when a vaccine becomes available? Will I stay sane or lose my mind in this atmosphere? And then finally, the big question is, will I live or will I die? So this is an aura of uncertainty that people are living through, and people don't do well in situations that are ambiguous like this. People crave certainty. There was a fascinating study done in 2013 in England. Of course, this is way before the virus hit, right?
Right.
People were given a choice of receiving an immediate electric shock, fairly intense, or waiting for some unspecified time to receive a lesser, milder shock. Well, most people chose to receive the stronger shock immediately. And that result was interpreted as people preferring not to have things looming over them, not to have the ambiguity of waiting for a shock. So they would take a more severe shock, knowing when it was going to happen. To me, that's very telling about human nature. You can think of the COVID situation as a global experiment in how people handle ambiguity. The coronavirus is unpredictable, a potential killer, and is tailor-made to generate anxiety at high levels, uncertainty and anxiety. So just as some people are at more risk of acquiring the virus due to predisposing conditions, other people are predisposed to be more affectable by uncertainty and anxiety by virtue of their genetics and their learning history. So we have a continuum, as I see it, Hamid. The continuum is on one side, people who are transfixed by this pandemic and the uncertainty generated by it. We have other people who have just general anxiety. Going toward the middle, we have people who have a reasonable concern about anxiety. And then on the other far end, we have people who are almost oblivious to it, and perhaps they're in denial about it. Well, that's the way I conceive of the psychological dimensions of this pandemic. And from a research perspective, what I've read, all indicators are that the psychological impact is greater anxiety and greater depression. And of course, anxiety is based on, cognitively speaking, constant worrying. And depression is constant self-doubt, which is another form of worry. So that's how I would characterize the psychological dimensions of this problem.
Thank you again for putting this in very simple way so people can understand it, as well as backing it up with the recent research. That study was also very interesting, the electric shock, and that also shows like how people are preferring something to happen immediately, even if it's something dangerous, as opposed to something which is going in uncertainty. And definitely in times of uncertainty like this pandemic put a lot of people in difficult situation. Let me ask you this question. You kind of answered partly, and follow-up question as this uncertainty you brought up. What's the effect of coronavirus pandemic on people's daily lives?
Well, of course, I can speak most authoritatively about the people I work with. What they've experienced is a profound disorientation, a rupture of the loss of routine and regularity. Had a regular world or in a routine world before the onset of COVID, and that's been shattered. So some of the issues, maybe it would be helpful to tell you some of the issues that people have brought up in psychotherapy with me, and I've listed them here, so I'm going to read so I don't leave any of these important issues out. The first issue is difficulties creating reasonable boundaries between work and family life, because now people are working at home. It's become difficult. The lines between work and family life have been blurred, and it has become very stressful for people. Allied to that, stress has been brought on by having to become a manager of children's schooling while also working full-time. I have a number of parents who sit there with their children during lessons, make sure they attend, and so forth and so on. And some people are actually doing the schooling themselves. What I've also seen is conflict between family members, especially if you have a family member who's trying to be conscientious about how he or she handles the virus versus other family members who don't take it as seriously. That continuum I was talking about, want to wear a mask. They don't adhere to social distancing. They don't take it as serious. Also, people have experienced drastic reductions in outlets for enjoyment. They go to a restaurant like they used to. That's easing up a bit, but still, it's a chore to go to a restaurant. They can't go to the movies, so they've lost that potential for enjoyment. I've noted with some people increased use of alcohol and marijuana, as self-medicating efforts on their part to manage anxiety and depression. Anger is another manifestation that I've seen. I can tell you a brief story. I had a patient who wanted to get a bagel, as I said, wanted to enjoy himself. So he went to his favorite bagel shop, and he went in the bagel shop, and he turned around, and on line behind him, and he was very conscientious about managing the virus, wearing a mask and so forth.
Right.
Turns around, there's a person behind him not wearing a mask. Mm-hmm. He immediately found himself getting enraged about this. And then he realized, looking at the counter of the store he was in, there was no shield. So all the bagels and all the pastries and everything were exposed, getting more enraged. And he said, at that moment, I felt like telling them all off and getting into this big row with these people. And I said, but you didn't do it. It's a good thing that you didn't do it. He looked at me perplexedly and said, why? Because I know that your main goal is to keep yourself and your family safe from this. What do you think would have happened if you had gotten to a face-to-face confrontation with somebody and not wearing a mask? They would have been yelling, spitting out at you potentially particles of the COVID virus. You would have gotten exactly what you didn't want. So we examined the situation, and I posed 4 questions. What do you want? What is the price of what you want? Are you willing to pay that price? And if you pay the price, can you actually get it? And clearly what he wanted was to stay safe, not to lecture people about COVID. Yeah. And that was the wise decision. So now we came to the conclusion that maybe you shouldn't go to shops that don't adhere to the model of wearing a mask. There are plenty of shops that on the door, the entrance to the business, it says no mask, no service. You can obviate all this. You don't have to be out there battling with people to get them to see it your way, because your main goal is to stay safe and keep your family safe. So that was an issue that came up in psychotherapy. 2 other things I've mentioned. I've had people who actually have had the virus, and we continued our sessions online while they had the virus. And these were middle-aged clients, and they did quite well. I mean, they were sick, like a very, very bad flu for them. One final thing I'd mention is the isolation that people have been experiencing obviously has worsened symptoms of depression. The people who've been affected most are people who have pre-existing conditions. If they had an anxiety disorder coming into the virus, of course, that's been exacerbated.
Dr. Pedoto, yes, I do have a question actually that I would definitely ask about this specific point. But before I ask that question, I just wanted to reiterate what you just mentioned about the safety first. And I think it's very important for everybody as part of the community, part of the society, to first of all think about your own safety in situations like this coronavirus. And now the flu season's actually going to start soon. People need to be more cautious. And that was a great example of what you advised to your patients, to stay calm. Obviously, when you talk more and when you get excited, when you get in a Even like, it's talking louder, then of course the chances of spreading the droplets increases. And you also brought up the idea of pre-existing conditions. And I have a question here. How this pandemic has affected patients with pre-existing mental health conditions?
Well, in general, it's exacerbated them. So they become more symptomatic. If you had health anxiety before the pandemic, your health anxiety has risen. If you had OCD, the pandemic, spreading germs to other people and making it has increased. If you had pre-existing depression, the isolation that you've experienced during the pandemic has likely exacerbated your depression. I see that in terms of referrals to my practice. Referrals to my practice have doubled or tripled in the past 3 or 4 months. Over 50 referrals.
Wow.
I couldn't possibly work with all these people. I already had a full slate. This is another thing I'd like to mention. Most psychologists like myself weren't doing telemedicine prior to this pandemic. In 2 days, I had to transform my practice, which was a face-to-face practice, into a telemedicine practice. And that was quite a challenge, let me tell you. And I didn't know if people were going to be interested in that or not. I just didn't know. I had no experience with it. Well, it's turned out that my practice is booming. I could work literally 5 days a week, 8 to 10 hours a day if I wanted. That would make me useless as a psychotherapist. I think so. I don't do that. But I'm just telling you, people who have pre-existing conditions who maybe never thought of going to, they were undiagnosed, maybe never thought of going to a psychologist before, are now doing it, are now coming in or trying to see somebody. What I'm saying, mirrors the surveys that I've seen. I saw one Canadian survey, for instance, that indicated that anxiety had quadrupled. Anxiety issues had quadrupled in the population, and the same upward spiral of depression.
That's huge. And your own experience of seeing patients and the number of patients referrals to you has increased. That definitely shows that overall in the stress, anxiety, and depression and all the psychological consequences of this pandemic. Just imagine if someone loses job in a normal day, like normal time. That really stressful situation. Leave alone this pandemic that is happening actually across the world, and here in the U.S., a lot of people are suffering from the socioeconomic implications of this coronavirus. And luckily that the number of cases has decreased significantly here in the U.S. and hopefully people will abide by the public health directives and we can contain the coronavirus, especially with the flu season coming.
Our first responders have been great here in the U.S. And I know they have been great in other countries as well. I had first responders come in for psychotherapy. Some started, and their problems were all about working as first responders. It's quite amazing, really.
I did hear maybe another session in the future, we'll talk about that important issue. I think it's also the burden of this pandemic is not only on, just regular people, but also on the health professionals, as you just said, the frontliners. They've been working hard, but I think also the burden and the stress work in a very stressful situation to save lives is really difficult for healthcare providers as well. Maybe we can talk another time about that issue. Let me ask you, what do you recommend to people under such circumstances? To which you talked about anxiety, you talked about stress and depression and all that. So what do you recommend to people under this tough situation?
Well, obviously the two major issues, as they are in psychotherapy and psychiatric circles, are anxiety and depression. And those are the twin pillars of people's psychological discomfort. So for depression, I can only give you treetop recommendations because it varies from person to person. For depression, I would say staying connected is quite important. You can do that digitally via media like this, but I encourage people to actually get out and see people. There are ways of seeing people, using social distance. One patient who goes every day and meets her friend in a local park, and they sit at a distance and have a conversation. And that's quite important. She suffers from depression, heeding the advice to stay connected. Another issue is maintaining a routine. That's very important for depression. That would include socializing, as I said, exercising, going outdoors, having a diet that is reasonable and healthy. Blood sugar levels influence mood as one aspect of the way diet helps or hinders somebody. And I would say that any activity defeats depression. And one of the first things that you want to help a person do when they're depressed is become more active. The more serious the depression, the more important it is for them to have a routine or to develop a routine and become more active. Another way of battling depression is to engage in some vital absorbing interest. You can see here, I have a vital and absorbing composer. I've been for the past my entire life, really. So I have patients who have begun painting, listening to music, interacting with pets. I had a girl just yesterday who were doing a session and her dog hopped up on her lap. So a little conversation about that dog, and you could see, and she suffers from depression. You could see how important that animal was to healing her mood issues. It was fantastic, really. And these hobbies will help you cut down on rumination, just mindless thoughts that roll one after the other, negative thoughts. Finally, I'll mention two things that are quite obvious. If you have a therapist, keep your appointments. If you don't have a therapist and you're having problems, consider finding one. I'm partial to cognitive behavioral therapy because that's what I've studied, but there are a number of therapies. If you have a psychiatrist, discuss whether you could benefit from a tweaking of your medication or an augmenter or something that can be added to help you manage your depression during this period of stress. Because after all, depression is a stress illness. Now let me get to anxiety and speak a little on that. What I would recommend, some things to help you with anxiety. Practice staying in the present. The nature of anxiety is constant rumination. This, I mean, a repetitive going over a thought or reviewing a problem. The more common term is worry, right? People worry. Rumination represents an effort to solve a problem, but the problem never gets solved. It's like a dog chasing its tail. So I've started many people out on the practice of meditation. There's plenty of resources online to help you get started with meditation. And meditation helps you stay in the present and also helps you create distance between yourself and distracting or anxious thoughts. There are other methods as well, progressive relaxation, abdominal breathing. These things all help. If you want to see a psychologist and you go to a cognitive behavioral therapist, they're going to challenge your anxious thinking. They're going to use a Socratic method like I used with the gentleman who was angry at the bagel shop. I asked him a series of questions, okay? Mm-hmm. So the idea of that is to get at the underlying distorted thinking that underpins anxiety. But with all anxiety sufferers, they tend to overestimate the possibility or probability of the occurrence of a particular unwanted event. They also overestimate the severity of the event. They think it's the worst is going to happen. And then finally, they underestimate their ability to manage the event. So as a cognitive psychologist, I'm constantly working with those aspects of their thinking to try to correct that by asking questions. Is that belief logical? What evidence exists for the falseness of that belief that you have? How is your belief helping you? Are there other ways of looking at the problem? If you didn't hold this belief, how would it benefit you? And then finally, if the worst were to happen, what resources do you have that would help you get through it? And it's through that series of questions that we can help people come to their own more reasonable perspective on what's making them anxious and hopefully reduce their anxiety. Again, if you have a therapist, keep your appointments. If you have a psychiatrist, discuss whether you could benefit from an additional medication or a temporary tweaking of your medications.
Absolutely. As we discussed earlier, this situation has put everyone under a stressful condition. It's not only people with pre-existing conditions or mental health issues, but also in general, the population are experiencing a situation which it's not something that happens on a regular basis. So this is something which is unique, and it put every walk of life into a difficult situation. As we were discussing with other guests earlier, that the people need to stay connected with their loved ones, with their friends and family, as you just mentioned. In other words, it's a physical distance rather than being a social distance, because you would still need to interact with your loved ones. And technology has made it very easy, as we are doing this podcast now through Zoom, and there are many other platforms that people can connect with families and friends and loved ones. And as you said, definitely in person is more important with considering the social distancing or physical distancing, and wearing masks, that would definitely help. And I do recommend people with pre-existing mental health issues to listen to their psychologists and psychiatrists, as you brought it up. This was a very interesting topic, and I don't know that we are already to the end of this. Let me ask you the very last and final question. And that's the question that I have personally myself, as well as, a lot of my audience. Let's say that this coronavirus is contained and the pandemic is gone, but there are still some concerns people have. How do you see the post-pandemic situation? Will people be experiencing some sort of post-corona stress or trauma?
Well, that's what it says in the literature. The expectation is a wave of continuing mental health issues. And that's pretty much clearly announced across the board. I referenced the Canada survey had found this quantum increase in anxiety and depression. We don't expect that to abate when the COVID virus is wrangled in, with a vaccine. In a more general sense, I'd like to just speak for a moment on what I think this is going to do in my profession. There's a strong possibility that the delivery model of psychological services will be altered in the direction of more acceptance of this online work. I found it to be quite useful for a great number of people, and people respond to it quite well. And I think that the convenience of it and the accessibility of it really speaks volumes to most people. As I said, I haven't had any problems getting people in for psychotherapy when I explain to them I'm only doing it online currently. No one has batted an eye about that. I think this might be a permanent alteration in the way people seek services from my profession. I'm also hoping that at a governmental level, the U.S. government is going to take mental health issues more seriously. I've already seen a shift in that. We've already had a relaxation, for instance, in the very health services that I'm talking about. Some of the rules and strictures have been lifted to allow it to occur, and the insurers have followed suit with that and are paying for these types of services. But for the individual, I think that people are going to be more health conscious after we get through this pandemic. There'll be more health consciousness, perhaps more concern about germs.
Let me just interrupt you for a second. I was trying to also end this question together what I just asked in a more positive way. And that's the silver lining of the coronavirus, as you just started. So please go ahead and tell us a little more of the silver lining of this pandemic.
Okay, silver lining. What did I find? During this pandemic, in my opinion, we've had a boom in self-development and self-reliance. Very interesting story I read. You know that the sales of guitars has boomed the pandemic. It's skyrocketed. The major companies, Fender, Gibson, Martin guitars, Taylor guitars, skyrocketing
You
sales.
see my guitar here?
You say you're one of them, maybe, that you was doing the pandemic. But what does that mean? That means that people during the pandemic are striving, even during the pandemic, have refocused on self-development, even during the pandemic. And in 2017, I read an article that quoted Paul McCartney said, the electric guitar is dead. You know, well, it's not dead, you know. People are buying guitars. And why are they doing it? This pandemic has brought out a wave of self-development and an increase in personal self-reliance. During the pandemic, I've had patients. I had a patient who wrote a screenplay. I had a patient who started a diet and weight loss program. I had a patient who did gardening for the first time, growing their own vegetables in their yard. I had a patient who took up cooking. And, you know, I had various people who went into greater depth into skills that they had that had been fallow for because they just didn't have the time. So I see that as a silver lining. More people with time to engage in self-development and to become more self-reliant. This haircut is an example of it. I did it myself, good, bad, or indifferent. Now, I did the haircut. I'd never done that in my life. And yesterday when you called me up, I was tiling my pool. The waterline tiles are on my pool, which I was going to farm out to somebody, but I said, let me try this. And guess what? It's done. I see this as the silver lining of the pandemic. Greater self-reliance and greater emphasis on self-development in people. There's evidence, as I outlined, that is occurring.
Let me just give you another example of what you just mentioned about, you know, sometimes we are so used to services being done for us and we don't really think about, like, you know, as you said, self-reliance, self-confidence and doing things. Yesterday, the battery of my car was not working. I couldn't turn on the car and I just, you know, had to use a jump start, and then I went to buy a battery. And where I stopped there, I was waiting for that guy to put it in my car, and he says, sir, we don't do that, we just sell it, so if you need the tools, please use our tools. And I said, well, I probably have the tools. So then I took the battery myself and I went back in my car and I got the tools and I just fixed it there. That's an example of like how we are sometimes used to these things. And this, the silver lining of the pandemic, not only because I did it because of the pandemic, but in general, it's that self-reliance, self-confidence that you need to do something which is, you know, a little out of the comfort zone. Thank you so much for your time, Dr. Pedoto, and it was really great advice, both for the public in general, as well as for people with pre-existing conditions, and backing up that with the recent research and your own experience. Again, it's been a pleasure to have you on the show. Wish you all the best. And for our audience, we will have more guests in the future. This podcast has started with health education, pandemic being one of the major issues right now. But obviously, whatever the health conditions and problems and situation is, we will focus different health topics. Looking forward to seeing you all in the next episode.